When someone becomes disabled and qualifies for Social Security Disability Insurance, or SSDI, they often wonder about their healthcare options. One of the most important benefits is Medicare coverage, but it doesn't start right away. In this video, we'll break down exactly what the Medicare waiting period is after you're approved for SSDI, why it exists, and how long you'll need to wait before your Medicare benefits kick in. Understanding these timelines is crucial for planning your healthcare and finances during this transition. Social Security Disability Insurance, or SSDI, is a federal program that provides monthly payments to people who are unable to work due to a qualifying disability. To be eligible, you must have worked and paid Social Security taxes for a certain number of years. SSDI is designed to help those who have contributed to the system but can no longer earn a living because of a serious health condition. Once approved, you'll receive monthly payments, but healthcare coverage through Medicare doesn't begin immediately. Medicare is a federal health insurance program primarily for people aged 65 and older, but it also covers certain younger individuals with disabilities. If you qualify for SSDI, you'll eventually become eligible for Medicare, which helps cover hospital stays, doctor visits, and other medical expenses. However, there's a waiting period before your Medicare coverage begins, which can be a source of confusion and concern for many new SSDI recipients. You might wonder why there's a waiting period for Medicare after you're approved for SSDI. The main reason is to ensure that only those with long-term disabilities receive Medicare coverage. The waiting period helps prevent short-term or temporary disabilities from overwhelming the system. This policy dates back to when Medicare was first extended to people with disabilities, aiming to balance access to care with program sustainability. The standard Medicare waiting period after SSDI approval is 24 months. This means you must wait 2 years from the date you become eligible for SSDI payments before your Medicare coverage starts. The Social Security Administration tracks this timeline automatically, so you don't need to apply separately for Medicare during this period. It's important to mark your calendar and plan for this gap in health insurance cover. The Medicare waiting period begins the first month you're eligible to receive SSDI payments, not necessarily the month you applied or were approved. There's often a 5-month waiting period before SSDI payments even begin, so your Medicare waiting period starts after that. For example, if your disability began in January, your SSDI payments might start in June, and your Medicare waiting period would begin then. Let's walk through a typical timeline. Suppose your disability began in January. After applying, you're approved for SSDI, but there's a 5-month waiting period before payments start, so your first SSDI payment arrives in June. From June, the 24-month Medicare waiting period begins. That means your Medicare coverage would start in June 2 years later. This timeline helps clarify when you can expect your health insurance to begin. Once you've completed the 24-month waiting period, you're automatically enrolled in Medicare Part A and Part B. You don't need to fill out a separate application. The Social Security Administration will send you information and your Medicare card about 3 months before your coverage is set to begin. This automatic process helps ensure you don't miss out on your benefits. Medicare coverage includes Part A, which covers hospital stays, and Part B, which covers doctor visits and outpatient care. You'll also have the option to enroll in Part D for prescription drug coverage and may consider Medicare Advantage plans for additional benefits. Understanding what's included can help you plan for your healthcare needs once your coverage begins. There are some important exceptions to the standard 24-month waiting period. If you have amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, you become eligible for Medicare the same month your SSDI benefits start. Similarly, people with end-stage renal disease, ESRD, may qualify for Medicare without the full waiting period, depending on their treatment situation. If you're diagnosed with ALS, you don't have to wait 24 months for Medicare. As soon as your SSDI benefits start, your Medicare coverage begins right away. This exception recognizes the urgent medical needs of people with ALS and ensures they get access to healthcare as soon as possible. For people with end-stage renal disease, or ESRD, Medicare eligibility depends on your treatment plan. If you require regular dialysis or a kidney transplant, you may qualify for Medicare sooner than the standard waiting period. The exact timing depends on when you start dialysis or receive a transplant, so it's important to work closely with your healthcare provider and the Social Security Administration. Many people wonder why Medicare doesn't start as soon as SSDI is approved. The main reason is cost and program sustainability. By requiring a waiting period, Medicare can focus resources on people with long-term disabilities rather than those with temporary conditions. This policy helps keep the program financially stable while still providing essential coverage for those who need it most. During the 24-month waiting period, you may need to find alternative health insurance to cover your medical needs. Some people qualify for Medicaid, state health programs, or coverage through the Affordable Care Act marketplace. It's important to explore your options early so you're not left without coverage while waiting for Medicare to begin. Medicaid is a joint federal and state program that provides health coverage for people with low income and limited resources. If your income drops after becoming disabled, you may qualify for Medicaid during the Medicare waiting period. Medicaid can help cover doctor visits, hospital stays, and prescription drugs, offering a safety net while you wait for Medicare. The Affordable Care Act Marketplace offers health insurance plans for people who don't have coverage through work or government programs. You may be eligible for subsidies based on your income, making these plans more affordable. Marketplace coverage can help bridge the gap until your Medicare benefits begin, ensuring you have access to necessary healthcare services. If you had employer-sponsored health insurance before becoming disabled, you may be able to continue your coverage through COBRA. COBRA allows you to keep your group health plan for a limited time after leaving your job, though you'll need to pay the full premium. This can be a helpful option for maintaining coverage during the Medicare waiting period. Short-term health insurance plans are another option, though they may not cover pre-existing conditions or offer comprehensive benefits. These plans can provide basic coverage for emergencies or unexpected illnesses while you wait for Medicare. Be sure to read the fine print and understand what is and isn't covered before enrolling in a short-term plan. Many states offer special health programs for people with disabilities or low income. These programs can help cover medical expenses during the Medicare waiting period. Eligibility and benefits vary by state, so it's important to check with your local health department or social services office to see what's available in your area. It's important to plan ahead for the Medicare waiting period. Review your current health insurance options, estimate your medical expenses, and explore alternative coverage if needed. By preparing in advance, you can avoid gaps in care and reduce financial stress while waiting for your Medicare benefits to begin. Mark important dates on your calendar, such as when your SSDI payments start and when your Medicare coverage will begin. Keeping track of these milestones will help you stay organized and ensure you don't miss any critical deadlines for enrolling in alternative health plans or transitioning to Medicare. Stay in regular contact with the Social Security Administration, SSA, to ensure your information is up to date. Notify them of any changes in your address, income, or health status. Good communication can help prevent delays or issues with your SSDI or Medicare benefits. Medicare is divided into several parts. Part A covers hospital care, Part B covers outpatient services, and Part D covers prescription drugs. Some people choose Medicare Advantage, Part C, plans, which bundle these services and may offer extra benefits. Knowing the differences can help you make informed choices when your coverage begins. Medicare Advantage plans, also known as Part C, are offered by private insurance companies approved by Medicare. These plans often include extra benefits like dental, vision, and wellness programs. If you want more comprehensive coverage, you can compare Advantage plans once you become eligible for Medicare. Medicare Part D helps cover the cost of prescription drugs. You can enroll in a standalone Part D plan or choose a Medicare Advantage plan that includes drug coverage. It's important to review your medication needs and compare plans to find the best fit for your situation. Medigap, or Medicare Supplement Insurance, helps pay for costs not covered by original Medicare, like co-payments and deductibles. These policies are sold by private companies and can provide extra financial protection. Consider your healthcare needs and budget when deciding if a Medigap policy is right for you. While Medicare Part A is usually premium-free for most people, Part B and Part D require monthly premiums. You may also have deductibles and co-payments. Understanding these costs ahead of time can help you budget for your healthcare expenses once your coverage begins. If you're receiving SSDI, you don't need to apply separately for Medicare. The Social Security Administration will handle your enrollment automatically after the 24-month waiting period. You'll receive your Medicare card in the mail before your coverage starts. If you have questions, you can contact the SSA for assistance. If your health improves and you return to work, you may still be able to keep your Medicare coverage for a period of time. The Social Security Administration has special rules that allow you to continue receiving Medicare benefits even if your SSDI payments stop. This helps ensure you don't lose health coverage as you transition back to employment. It's important to report any changes in your work status, income, or health to the Social Security Administration. This ensures your benefits are accurate and up to date. Failing to report changes could result in overpayments or loss of benefits, so stay proactive in communicating with the SSA. If your SSDI application is denied, you have the right to appeal. The appeals process can take time, and delays in approval will also delay your Medicare eligibility. It's important to follow up on your appeal and provide any additional information requested to speed up the process. Applying for SSDI and understanding Medicare can be complicated. There are organizations and legal aid services that can help you with your application, appeals, and understanding your rights. Don't hesitate to seek assistance. if you're unsure about any part of the process. The Social Security Administration and Medicare websites offer detailed information about SSDI, the waiting period, and Medicare benefits. You can also call their helplines or visit local offices for personalized assistance. Staying informed will help you make the best decisions for your health and finances. Many people have questions about the Medicare waiting period, such as whether it can be shortened, what happens if you move states, or how to handle medical emergencies during the gap. It's important to get clear answers from official sources and plan accordingly to avoid surprises. There have been proposals in Congress to eliminate or reduce the 24-month Medicare waiting period for SSDI recipients. Advocates argue that immediate access to healthcare is essential for people with disabilities. While no major changes have passed yet, it's a topic of ongoing debate and advocacy. Disability rights groups and healthcare advocates continue to push for changes to the Medicare waiting period. They highlight the challenges faced by people with disabilities who go without health coverage during this time. Staying informed about advocacy efforts can help you understand potential future changes to the system. The Medicare waiting period doesn't just affect individuals, it can also impact families. If you're the primary breadwinner or caregiver, your family may need to adjust to changes in income and health coverage. Open communication and planning can help your loved ones navigate this challenging time together. Waiting for Medicare coverage can be stressful, especially if you're dealing with a serious disability. It's important to take care of your mental health during this period. Reach out to support groups, counselors, or mental health professionals if you need help coping with anxiety or uncertainty. Managing your finances during the waiting period is crucial. Create a budget, track your expenses, and look for ways to reduce costs. Consider speaking with a financial advisor who understands disability benefits and healthcare costs to help you make the most of your resources. If your disability is expected to last for many years, it's important to plan for the long term. Consider your future healthcare needs, possible changes in benefits, and how to maintain your quality of life. Long-term planning can help you feel more secure and prepared for whatever comes next. Once your Medicare coverage begins, review your plan options each year during open enrollment. Your health needs or available plans may change, so it's important to make sure your coverage still fits your situation. Staying proactive can help you get the most out of your Medicare benefits. Connecting with others who are going through the same experience can be incredibly helpful. Support groups, both in person and online, can provide advice, encouragement, and practical tips for managing the Medicare waiting period. Don't hesitate to reach out and build your support network. To sum up, the Medicare waiting period after SSDI approval is typically 24 months, with some exceptions for certain conditions. Planning ahead, exploring alternative coverage, and staying informed can help you manage this challenging time. Remember, you're not alone. There are resources and support available to help you through the process. Navigating the Medicare waiting period after SSDI can be complex, but understanding the rules and planning ahead makes a big difference. Stay proactive, seek help when needed, and keep track of important dates. With the right information and support, you can bridge the gap and ensure you have the healthcare coverage you need. Thank you for joining us to learn about the Medicare waiting period after SSDI. We hope this information helps you or your loved ones navigate the process with confidence. Remember, there are resources and people ready to help you every step of the way. Take care and stay informed as you move forward.